Very well. That was an introduction about AyurvedaMap. I welcome you all on behalf of AyurvedaMap for today's live session on acne. This is Dr. Akshata, and once again, welcome you all for today's session. Before we start off with the session, I would like to give a small introduction about our upcoming courses. So we have postgraduate diploma in Ayurveda Cosmetology and Trichology course coming up. So the bookings have already about to close, and we have few more seats left. So kindly, dear participants, tell your friends and colleagues and who all are interested to join this course to hurry up and contact AyurvedaMap. We have few seats remaining for this course. Also, we have postgraduate diploma in clinical cosmetology course coming up. So you can become a clinical cosmetologist. There will be hands-on training, and the classes will start from March 31st. So there will be 18 online and 6 offline classes. So for further details, kindly contact AyurvedaMap. Also, we have a diploma in Ayurveda cosmetology course coming up. The duration will be 6 months, and it will be offline course. Also, again, it will be online, as well as there will be hands-on offline training. So location will be Pune and Bangalore, and you will also be getting UGC certified certificate. So kindly contact AyurvedaMap for further details. Also, we have a Ayurveda gynecology course coming up, certificate course called Pushya. So the classes start from May 28th, and it's a 3 months duration course, and the mode will be online. So different gynecological conditions and the use of Panchakarma and how to manage all the female fertility related issues. So you will be learning from this course. Also, we have a product making masterclass, Siddhi, 2-day product making class. So it will be conducted during May 24th to 25th. So kindly contact AyurvedaMap for further details. So coming to today's session, we have our guest speaker with us, Dr. Anila. So Madam is an Ayurveda physician with 10 plus years of clinical experience, and she's an expert in cosmetology with PG diploma. She's also the course coordinator, PGDAC by AyurvedaMap. And also she gives hands-on training to many of the students who come for the certificate course. And she's also skilled in integrating modern techniques with Ayurveda cosmetology and experienced in managing skin and lifestyle disorders. On behalf of AyurvedaMap, I welcome you for today's session, ma'am, and over to you for today's topic, that is acne management.
Can I share the slide, Doctor?
Yeah. Visible.
Visible, no, Doctor?
Yes, it is visible.
So good evening, doctors. Myself, Dr. Anila. So I think, familiar to most of you, because when I just went through the participants list, most of them are our students itself, who has been the participants of PGDAC, Postgraduate Diploma in Ayurveda Cosmetology. So it's an immense pleasure to be here. And let's have a discussion about acne and how we can manage acne through Ayurveda cosmetology. So I would like to tell a few words about Ayurveda cosmetology and why it is receiving such a such a warm welcome in when it is pertaining to our patients and also within our doctors, because the results are what it speaks. And whatever treatment and whatever things we are giving, it is completely Ayurveda. It is we are giving internal kashayas, we are doing all kind of packs, we are giving even kashaya chalanas and all. But Here, the difference is like we are pairing up our techniques, the aesthetic techniques with our medicines to get the 360-degree result out of it. Okay. So now let's move on to the technical session. So acne is a common skin condition that occurs when the hair follicles become plugged with oil and dead skin cells. Okay. Which often causes blackheads, whiteheads, and pimples. So major site of appearances are face, forehead, chest, upper backs, and shoulders. So doctors, this site of appearance is very important. Okay. So when a patient comes to you and when the patient complains of such kind of eruptions on the areas rather than these things. Okay. Rather than these areas, it is something which is to be noted from your side. Okay. Because acne vulgaris is majoritarily seen in face, forehead, chest, upper back, and shoulders. Okay. Then most common, it is seen among the teenagers, though it may affect the people of all ages. Okay. Next, about the prevalence. Acne is highly prevalent in India, affecting a significant portion of both adolescents and adults. Studies indicate that acne affects approximately 72.3% of adolescents and 27% of the adult population in India. So coming to the adult population of India, the 27% of adult population of India. So most of this will be ladies, okay, females, 35 plus, okay. And these are the cases which we normally get in our clinics. We do get the teenagers, but the problem with teenagers is like they are not ready to wait. It's not like ready to wait. They are not ready to what? Some of them are, they find it little bit difficulty in taking kashayas and all, but most of the adult acne, they will definitely come to you. Okay. While most commonly associated with adolescents, acne can persist into adulthood and even begin in later years. Okay. So now moving on to the cause, we know some of the causes: exposure to extremely hot or cold temperatures, stress, oily skin, endocrine disorders, use of drugs such as cortisone, male hormones, or oral contraceptives, family history of acne, and some cosmetics. Doctors, whenever acne comes to you, whenever an acne case comes to you, you have to be very judicial. Okay. Don't just prescribe medicines. Don't just give external therapies and don't just let them go. First of all, you have to take a thorough examination. Thorough examination means you have to take a detailed case history. Like when did you have the eruptions? How did it come? Whether it was pus filled, whether it was just as a pus in the top point, whether it was a papular lesion, whether it was a pustular lesion, and what you see on the face, whether the comedone lesion was present. These all things you have to note down, and the duration. And you have to also check, if it is a lady, you have to check the menstrual history, and also familial history is very important. And then look for the job, whatever job they are doing. Okay. And then ask for the previous medications, and please do ask for the previous treatments they have done, because in the most of the cosmetology clinic, what is happening is like the patient will come, walk in, and they will tell, see, I want to do a hydra facial, okay, or I want to do a party peel, or I want to do this laser, please do this to me. This is what they ask, and that is what the service they are being provided, and which is highly unscientific. Okay. So you have to take a thorough examination, thorough case taking. And then if you have a dermoscope, please do visualize the lesion through a dermoscope. Okay. Then see whether it is sensitive. So how do you see something as a sensitive through a dermoscope? You can see that pinkish color. Okay. You can just put it on other area. You can see something like the skin color itself. When it is when there is any kind of infection or inflammation or sensitivity, you will be seeing as a pink color. Okay. So you have to note that. That is very important. And if at all they have come after any aesthetic procedures like any lasers or chemical peels, you have to be very judicial before touching the case. Okay, because we shouldn't get what? Bad name. That is very important. Okay, we should not be defamed. That is very important. So Whenever an acne walks into your OP, you can manage it in the OP. You can just manage it by, you can also manage it by giving internal medicines and external small therapies. No need of purchasing all those big machineries and keeping, no need, but still you can manage it. But be very cautious like what they have done in the previous thing. Okay. I hope the point is clear. Next is acne signs and symptoms. Okay. Varying upon the severity of condition, you can see whitehead. What is a whitehead? A comedone, which is, the duct which is closed is a whitehead and which is open is a blackhead. Whitehead you can't extract, blackhead you can extract. And you get papules. What is a papule? Which is a small red tender bumps. Okay. And when it comes to pustule, the papules with pus at their tip is called as pustules. Okay. So pustules you can see in mostly in the pimple. That is what we call a pimple. Okay. Which is having a reddish border and it will be having a small pus. Okay. And you get cystic lesions when it comes to the conditions like acne conglobata. When it comes to the conditions like hormonal acne, you always come to see cystic lesion. So what is the cystic lesion? See, it is a painful pus-filled bumps which is seen beneath the surface of the skin. Okay, so in that condition, what I suggest is like don't do any kind of massages or don't do any kind of such treatments because it's better you don't touch those lesions. Okay, you should not put any pressure on that lesions because there is high chance of spreading. Okay, so next is nodular lesions. Okay, so nodular lesions, how do we understand? You know the nodules, like you have seen nodules. So it is a large, solid, painful lump beneath the surface of the skin, which is called as nodules. So nodules and cystic lesions you can see in the case of acne conglobata, and you can see it in the cases of hormonal acne. Okay, and when it comes to such kind of, when you are using some cosmetics, you don't know that this cosmetic is not going okay with your skin, but you're still applying and applying and applying. So what happens? The pore is getting blocked. The symptom, the cause which is again aggravating. Okay, the pus-filled things, the duct, the sebaceous duct is getting blocked and it is becoming inflamed, and again you are doing the same thing, and if at all there is any miss thing in your ahara vihara, this can go into a cystic lesion. So you have to be very judicious, and I want all of you to write all these terms in your case sheet. Like once they come to you, what you sow a blackhead. Okay, it is, they are having blackheads, comma, they are having papular lesions, comma, they are having pustular lesions. You have to write like this. Okay, don't write pimple. You have to write like this. Okay, what you see. See, these are the blackheads. Can you see with the black in the top? This is whitehead. So whitehead extraction is very difficult because the opening will be closed. So you can see papules. See, you can see papules. See pustules. The papules with pus in the point. Okay, you can see cyst. See, look at the cyst. This is a nodule. Now, coming to the pathogenesis of acne. The main cause is like increased sebum production. What is the reason of the increased sebum production? The increased sebum production is because of the presence of the excess presence of the androgens. And there will be hyperkeratinization of the pilosebaceous unit. So you know the pilosebaceous unit. So what is the pilosebaceous unit? The hair follicle with the sebaceous gland attached. Okay, so you have the cells which is ORS, the outer root sheath. Okay, so these are the cells which produces the sebum, the sebocytes. So what happens? There will be hyperkeratinization of the pilosebaceous unit. So what happens once it is the external opening is closed and there is hyperkeratinization of pilosebaceous unit and there is a more sebum production. So what happened? It is closed, right? So it is being collected. So once it is being collected, what happens? There will be definitely an infection. So increased colonization with Propionibacterium. So there will be inflammation. So this is the flow chart. See, excess circulating androgen, which causes the enlargement of excessive secretion of the sebaceous gland, which causes the increased production of sebum, which causes the blockage of opening of the sebaceous gland, and in turn, which results in the promotion of growth of propionibacterium, and which causes the infection of sebaceous gland, which moves on to acne vulgaris. Okay, so this is why the pathogenesis is very important. See, the pathogenesis is very important because the patient will be coming in any of these stages. Okay, so you should know where you have to break. Okay, so the pathogenesis is very important because most of the cases, what we do is like when we get a patient with acne, what we do, we will say, okay, you are having an oily skin, so let's strip off the entire oiliness from your skin. You should not do that. Okay, you should not do that. You are instead harming the skin. Okay, what you should do, the hydration must be there, but the excess oiliness only should be removed. Okay, so for knowing that things, you should know the pathogenesis very well. Okay, so in the acne pathogenesis, we have 4 parts. So one is increased sebum production. The another one is abnormal follicular desquamation, okay, which causes the altered follicular milli, and which causes the propionibacterium acne colonization and proliferation, which in turn causes a inflammation. So you know, there are the sebocytes causes seborrhea. Okay. Now, these are the types of acne. So let's look into different types of acne. Important different types of acne. Okay. So one is acne conglobata. So can you see the pic? See, in the pic, you can see how it is like, it is always associated. You can see one cystic lesion, nearby you can see another cystic lesion, nearby you can see another cystic lesion. So this will get coalesced and it will become a big lesion. Okay, so how does such a patient present before you? So when you see the face, you can see such kind of thing, and the patient will come to you and patient will tell you, doctor, I am having this kind of lesion in my face, okay, and I am having some pus-filled, okay, pus-filled pimple-like things in my scalp also. Okay, they'll complain of that also. And you can see the serosanguinous things coming out, like pus-filled things coming out of the scalp. They will also complain to you about hidradenitis suppurativa. So what is this? This is a kind of cyst, which you can see under the axilla and all, which is due to the androgen excess. So these are the triads. Okay, so the patient will clearly tell you these all symptoms. Okay, this is how you diagnose, because the diagnosis is very important, because we writing the names of such kind of things is very important. We should be able to diagnose. Okay, and severe form of acne causing large inflammatory pimples, nodules, and papules. Next, intercommunicating abscess, cyst, and sinus loaded with serosanguinous fluid or pus. Takes months to heal, causing hypertrophic scars. That is an important feature that will cause hypertrophic scar. So how can we manage? How do we manage such a case? The line of treatment must be Kaba Medohara Chigitsa. So look into the diet, correct the diet. Okay. Major problem is with the diet. Okay, because when they will be going and they'll be taking all kind of this kind of medications. No one will be telling them, don't eat excess of oily food, don't eat this in this time. Okay, instead you have to eat this in this time. Such kind of regulations and nothing, no one will be telling them. So they will be sticking on to their diet and they will be taking the medicines. So you have to make it clear, like the treatment should be Kaba Medohara treatment, which you have to give, and the diet also you should modify accordingly. You can give Varanadi Kashaya, you can give Padola Kadrohinyadi Kashaya, you can give Nimbadi Kashaya, you can give Trayandyadi Kashaya, you can give Gugulu Panjabalam Churnam, Tribala Churnam, Shalanam you can give. See, Triphala is a wonder drug when it comes to cosmetology, Ayurveda cosmetology. Okay, it will give you tremendous results with the Tribhala Shalana. Okay, and if you want, you can add other drugs also. You can add Yeshti, you can add Nimbatuk. That is up to you, what all you have to add. Okay, next is occupational acne. Okay, occupational acne. So that is caused due to the exposure to the industrial chemicals. Okay, some of them is chloracne. when they get this exposed to this kind of dioxins and all, and gas, I mean oil acne, okay, and there is a coal tar acne when they get exposed to these kind of things. And the main important thing is predominantly comedones. See, look at the picture, predominantly comedones. See, another important thing is unusual sites of involvements, that is in the forearms. So, was forearm discussed as a major site of acne in the previous slides? No, right? So, once you see acne in unusual sites of involvement, you should note that. Okay, an unusual age. This is mostly seen in the middle-aged men. This can be mostly seen in the middle-aged men also, if they are into such kind of surroundings. So, Kalyanaga Kashayam, Kulagadi Kashayam, Padoladi Kashayam, Avibati Churnam, Vilvadi Guliga, Tribhala Kshalanam. Okay, next is cosmetic acne, as I told you. See, there is something which I want to explain in this slide is like, what is, like, when a patient comes to you with an oily skin, and they will tell you a lot of things they are using. Doctor, I use this moisturizer. Doctor, I use this sunscreen. Okay, I am using this cleanser. I am using this thing, that thing, everything. They'll come to you and they will give it to you. Okay, they nowadays what they do is they bring it by hand and they will keep it on your table. So take each product, turn back, and then just go through and see which medium it is. Okay, if it is in a cream medium with a matte finish, tell them you should not use this if at all they are having acne, if at all their skin is sensitive. Tell them to use something which is in an aqua or gel based. Okay, and I would suggest no creams whenever they are having acne. No creams at all. If at all they are having an oily skin, which is a pimple prone and it is a sensitive, what I suggest is no creams, because I don't want to take chance. Okay. What happens? They'll apply this cream. When they are sitting inside, it is okay. They will move into the sun. They will sweat. Again, the same thing is going to build up. Okay. So the same scenario is going to come up. So why should we take risk? So whenever the patient comes to you with the acne, check for the cosmetics they are using. Okay. And they'll be using all kind of liquid correctors. Okay. That foundation thing and everything. So ask them, you should not use this. You should stay away from this, because there is something which is a very noble concept. Okay. You should allow your skin to breathe rather than, loading it with a lot of cosmetics. You should give time for your skin to breathe. Okay. And almost always comedones and lesions frequently on the chin. So this is the same with when you are, you have done a facial procedure, you come back home, and after 1 to 2 weeks, you might get these kind of lesions on your chin area. Okay, so that is known as a post facial acne. Okay, post facial acne, and you will get it in the chin line itself, and you will be having all that itching, burning sensation and all, and it will be normally papules. There won't be any comedones. It will be papules. Okay, so there you should always go for a Vishahara Chigilsa. Okay. So this is Mugalebha Visha, Patmini Kanda Pidaga, Nimbadi Kashayam you can go, Guluchadi Kashayam you can use, Tribala Kshalana. Next is drug-induced acne. So drug-induced acne means most of the steroids, androgens, anabolic steroids, okay, and anti-TB drugs, iodides and bromides, anti-convulsant, okay, and lesions, monomorphic. See, this is important. So how does the lesion come? It is monomorphic, consisting of papules and pustules of the same size. Okay, so nothing will be big, nothing will be small. Okay, it will be of all the same sizes. Trunk, especially back and face involved. Okay, so if your patient is having dandruff, they will also come with the same symptoms. So how do you understand? They will be having acne in the forehead. Okay, forehead region. And they will be having acne in the back. And they will be having that kind of lesions in the chest portion also. And in the most worsened conditions, they will be having it in the, the forearm. Not in the forearms, along the shoulder region they'll be having. And if you ask them, they will, if it is a male, you can just check, they'll be having that kind of, scalings in the beard also. Okay, you can just check it and you can confirm. So always buy a dermoscope. Okay, you should have a dermoscope. You should show them, see, this is this. Because nowadays, if you just sit and you just say, okay, you are having pimple, you are having pustule, they won't trust you. Just show it to them. See, this is like this lesion. This is a pustule. So you are having this kind of lesion. So you have to take internal medicines. They will be okay. They will be happy. So don't just sit and just vague out things like, okay, you are having this, you are having that, so we will do this. They won't be happy with that, because we should show them, see, your skin is having these kind of changes. So this is these kind of changes. So this is because of this. So you have to take this. They'll be happy. Next is late onset acne, which is called as an adult acne, which comes after 25, once you are 25 years old. Predominantly, it will be deep-seated persistent lesions on the lower half of the face. That is very important. When it is an acne, hormonal acne, you can just see to the patient's face and you can say, see, you are having, are you having any problem with your periods? So they'll say, no, doctor, my periods is very cyclic. So you ask them, so how is it? Was the flow the same? The days are the same. Do you feel like any difference from the like you had in the previous time, or you can ask like this, like before delivery how it was, and after delivery how is it? So if you ask them like this, they'll tell you, yes doctor, I am having some sort of changes after that, and they'll list out. Okay, then you can just look into the nape of the neck. They'll be having that darkness. You can ask whether the darkness in the axillary region and in the between the thighs and everything is becoming more pigmented. So they'll say, yes doctor, yes I am, it is becoming more pigmented. And if it is moving on to a severe case, you can ask whether you are having any cyst like lesions in the base of the hair follicles, that, as I told you, hidradenitis suppurativa, most of them is having. Okay, so what they mistake it is because once they are using the razors, it is becoming it is becoming cut open. So like that, I got an infection. That is all they think, but it is not like that. Okay, so you can ask them. Exclude underlying androgen secretion pathology, especially polycystic ovarian syndrome. When it comes to an ovarian cyst, it is very beautifully seen. Like in which ovary there is the cyst is present, overactive, it is present. You can see the face, and exactly that side, they'll be having more pimples. They'll be having the pimples along the cheeks more, along the chin more. The other side of the face, it will be cream. You can see like that cases comes to us. Okay. So how do you understand? According to the presentation, hormonal correction should be done, and anti-dandruff. They'll come and present you with the wet dandruff. Definitely. So what is a wet dandruff means? It will show you as a flake. Okay. Acne excori, which is seen in young girls, it is because of the pricking nature. See, I always tell this when a teenager comes, what their problem is, like they have a tendency to pop up the pimples, right? When while in the treatment, we pop up the pimples only when it is paga. We just put a small pressure and we just pop it up, or else we'll give small svedana. Very small, with small potli, with triphala or with cotton dipped in triphala kashaya, like that. So it will just break open. We'll just mildly, very mildly, we'll be giving pressure so that the entire thing comes out. Okay, that is perfectly okay. In such cases, it will heal without any scar. But what these people do, they will touch, and they will burst it off. Okay, when they touch again, means the heat is again coming up. So the infection will come up more. So you have to tell your patient, don't touch the lesions. Don't touch the lesions. Rather than you applying something on the face, that is fine. Otherwise, these people have a tendency to just what? Just rub over that area, just scratch over that area. Okay, this is seen in young girls who excessively pick their mild acne. Okay, results in discrete excoriations on face, while comedone's papules are few and far in between. Okay. So you can do Jalugavajaranam mainly. Okay. And Panchatiktam Kashayam, Shonidamradam in Ishti Tribalak Shalana is the best thing you can do. Next is acne fulminans. Okay. So this acne fulminans and acne conglobata, both should be what? You should you should differentiate the both conditions. So acne conglobata, you know. But when it comes to acne fulminans, it will always have a systemic what? A systemic presentation. It will be followed with a fever, myalgia, arthralgia, okay? And the lesions will be crusted and ulcerated, okay? It will be an acute onset, so you should give Guluchadi Kashaya, Sudarshanam Guliga, Vilvadi Guliga, Rubalak Shalna, Gobi Chandanadi Guliga. I had a patient, but it was not like a fulminance and all. She had developed this after a fever. Okay, so it was correct pustules. And next is the diagnostic criteria. How do you diagnose acne vulgaris? Okay, so acne vulgaris is always diagnosed through the clinical examination. Okay, and lab investigations are very rarely needed, and they are primarily used in specific situations such as when there is suspicion of underlying hormonal imbalances or infections that might be contributing to acne. That is very important. Once you get a acne case, I told you, once what we will be doing, we will be taking the detailed history, we will be taking everything, we will be visualizing the lesions, and then we will come up to a what diagnosis. Okay, this is acne vulgaris. So in certain cases, we will take some kind of hormonal assays also, okay, to know what kind of acne this is. Okay, so when a patient is having polycystic ovarian syndrome, okay, so what when it is suspected, we do total and free testosterone, okay, dihydroepiandrosterone sulfate, and androstenedione, luteinizing hormone, FSH, lipid panels, okay, glucose levels and insulin level, okay, refractory or persistent acne, okay, if the acne is not responding to long term of antibiotic treatment. I had a case, okay, she was into such kind of antibiotic treatment for nearly from her 18 years, and she came to me when she was 35 years old. Okay, so she was going through that antibiotic course, and she came to me, and we managed it through our medicines, but the problem was with the scar, because that scar was that old. Okay, so we did micro needling, and we didn't go for any lasers, chemical peels, nothing. We just did micro needling, and we are planning for a facial PRP. Okay, so if acne does not respond to the long-term antibiotic treatment, or if the condition worsened despite antibiotic use, a skin culture might be done to rule out the gram-negative folliculitis. Okay, now nutritional deficiencies like vitamin B12 all can contribute to the, this can be contribute to the acne. Next is diagnostic criteria. Okay, presence or absence of comedones. That is very important. When it is acne, there will be the presence or absence of comedones. Okay, like the presence of comedones will be there in the case of acne. But when it is a rosacea, so what is the rosacea symptoms, doctors? What is rosacea? Rosacea is nothing which is an autoimmune condition. Okay, it is a rosacea is an autoimmune condition. Can you see any kind of blockage symptoms in that? No, you can't see comedones. See, the comedones will be present if it is acne. Comedones will be absent if it is rosacea. Okay, in the rosacea, you just see flare-ups. That's it. You can't see any kind of comedones because there is no what? No blockage in the case of rosacea. Okay, the location of lesions. Acne typically affects the face, chest, and back, while rosacea is more localized to the central face. Okay, particularly to the cheeks and nose. Have you seen such cases? Next is patient history. A thorough medical history, including any medications the patient is taking, is crucial in identifying the potential drug-induced acne, induced acneiform eruptions, like what we called as drug-induced acne. Okay, so you should take a thorough medical history, because most of the ladies in their 30, when they are 30, 35, they'll be taking this hormonal pills. Okay, they'll come to us and they'll complain of acne, or they'll come to us and they'll complain of us about hyperpigmentation. We will be sitting and treating. Okay, we will be not looking like whether they are taking these tablets or they are not taking these tablets. We'll be sitting and treating, and we'll be thinking like, why no response is there? No response is there because you didn't figure out what any kind of drugs which they are using or not. Okay, that is because why you didn't get the result. Okay, next is clinical examination. A visual examination of the skin can help distinguish between different conditions, such as grouped perioral distribution of perioral dermatitis. That is something which you have to Differentiate. Next is differential diagnosis. That is rosacea, which is a chronic inflammatory skin disorder characterized by facial redness, papules, pustules, often with a telangiectasia. So what is that? That is nothing but you can see small blood vessels. Okay, which is very when it comes in the flare-ups. Okay, unlike acne, rosacea typically lacks comedones. That is the main differential diagnosis. Okay, next is perioral dermatitis, which I call the condition presents as grouped erythematous papules around the mouth, only around the mouth. Okay, often sparing the lip margin. It will be seen as you put an bulgan, some kind of this thing is there, no? The same way it will come. Okay, it is more common in young to middle-aged women. Okay, drug-induced acneiform eruptions. These certain medications can cause acne-like lesions. This include corticosteroids, anti-seizure drugs, lithium, isoniazid, and anabolic steroids, and folliculitis. Okay, folliculitis, you know, it is an inflammation of hair follicles. So how do you differentiate folliculitis and acne? See, folliculitis will be seen in the particular area. Okay, and the acne will be most commonly seen in its site itself. Okay, and it can manifest as small red bumps and pustules that resemble acne. But this is how you differentiate, because mostly folliculitis you can see in the leg area, okay, in the arm area, which is not the major site of appearance of acne. Next is keratosis pilaris. Is a condition causes rough, small, red or flesh-colored bumps, particularly on the upper arms, thighs, and buttocks. It is not considered as acne, but it is often confused. Other conditions like Demodex folliculitis and pseudofolliculitis barbae and nevus all can be mistook as what? Acne. See, this is an important assessment. Okay, clear, almost clear, mild, moderate. So we should know about mild, moderate, severe, and very severe. See, mild is something which is easily recognizable. Less than half of the face is involved. Okay, in the mild, you can see many comedones, many papules, pustules are present. See, this will be scattered here, there, here, there. That is mild. Okay, from the pustules is the maximum biggest lesion you can see, or it's the maximum serious lesion you can see in a mild acne. So mostly when it comes to something which is related to the cosmetics and all, you can see mild acne. Okay, when it comes to moderate acne, more than half of the face is involved. In that case, you also get papules and pustules, but the extent of the spread will be more than half of the face. Okay, that will be very near, you will get the lesions. Okay, next is severe. Severe and very severe you can see in the case of hormonal problems. Okay, the entire face involved is covered with comedones, numerous papules, pustules, and few nodules and cysts. When it is very severe, highly inflammatory acne covering the face, nodules and cysts are present. So normally we just consider mild, moderate, and severe. The very severe and severe is grouped into severe. Okay, so when it comes to severe, you see two more extra lesions. That is cyst and what? Nodular lesions. Okay. So this is the treatment which we see. Why you should know this is because the patient will come to you and show you, doctor, I have been using this cream since this much days, but I have no result. Okay, or he or she will come to you, doctor, I am using this cream, my skin is getting peeled off. It is becoming more sensitive. I can't use this. So, or else they will come to you, they'll tell you, doctor, I took this antibiotic, OD for 6 days. Then I took a break of, say 15 days. Then again I started, or I took it for 1 month. Then I waited for, say a period of 15 days. Then I started again. So you will ask what medicines you took. Oh, doctor, sorry, I just forgot the prescription and I don't have that prescription. So you should know what tablets and what medicines these people are giving, right? Then only you can understand what all have undergone, what all this patient has undergone. Okay. So the initial treatment, when it comes to comedones and papules, the initial treatment will be just a topical application. So what are the topical applications which we can see? We can see retinoid, benzoyl peroxide, adapalene, etc. in the what? In the external application. So first, so either you can see tretionins. Okay. So what is the concentration? 0.025, 0.05, 0.1, such kind of this thing you can see. So once the retinoids they are using means the skin will be become more sensitive and peeling off will be there. Okay. So the patient will come to you and tell you, see, doctor, I used one cream and my skin is becoming red. I'm feeling burning sensation. So you should understand, okay, they have used retinoid. So once they have used retinoids means the external, the stratum corneum is getting peeled off. Okay, so it is getting peeled off means the skin is becoming sensitive. So you should not give any gel or any cream or nothing. You should only give shalana. Okay, so first we are looking for the repair. You should not say, okay, come, you just lie down, we'll do a facial. No, you should first give a shalana. Okay, then you like that you have to manage internal medicines you have to give, and you have to tell the patient, see, don't go to the sunlight more. If at all you are going, you use this sunscreen. Okay, don't get much exposed to heat. These all things you tell them. Benzoyl peroxide is like comparatively safe. And you get adapalene also. Adapalene also will be there in their combination. Or after that, what they will do, they will take one of the things, benzoyl peroxide plus some antibiotic, or adapalene plus some antibiotic. This is how the external treatments will go in the case of mild acne. When it comes to the moderate acne, they will start with small amount of what? They'll start with small amount of internal medications. They'll be giving retinoids internally. They'll be giving antibiotics internally. Okay, and they will be also going for the topical combination treatments. What is the combination treatment? The cream won't be only for benzoyl peroxide. The cream won't be just a retinoid. It will be a combination. Once it comes to severe acne, they will put the patient on continuous antibiotics, oral antibiotics, plus topical combinations, plus hormonal therapies if it is a female. See, these are the choices which they have, which they give. Okay, so you should know. Once a patient is coming to you with a cream, with a gel, with a thing, you just look into the combination. You should understand, okay, this is this combination. So once they use this combination, so these kind of problems, the patient will come and tell it to me. So you should know, you should tell them, okay, this, no, this is this. Do you have such problems? So he will have a trust on you. Okay, this doctor is knowing this much. I'll trust her. I trust her. So this is how you build up the trust. For building up the trust, you should know the modern aspect also. Okay, so you should not be like, okay, I am an Ayurveda cosmetologist, I'm just looking into Ayurveda. No, you should know what the other wing is also doing. Okay. So next, what we will see. When it comes to the comedones, we know exfoliation is a treatment. So exfoliation is of two types. What are the two types of exfoliation? Physical exfoliation and chemical exfoliation. So what is physical exfoliation? Physical exfoliation is nothing but the use of scrubs. You take some kind of scrub, you scrub it on the face, and you take that comedone extractor. Okay, you extract the comedone. Done. Exfoliation, physical exfoliation is done. Okay. So what is chemical exfoliation? Chemical exfoliation is with the chemical peels. Okay, so that is the next, what you can call it as a Vajrayuda. The next Vajrayuda they means mostly the doctors are doing is chemical peels. But doctors, be very judicial when you treat a patient who has taken chemical peels. The skin will be entirely damaged. Okay, the skin will be entirely damaged. They are going for treating the pimple, they'll come with the hyperpigmentation. Okay, so I know most of the people sitting over here, most of the doctors, they have completed their PGDCC, so they know. So once you are doing a chemical peel, once you're doing a BHA, you have heard about AHA, BHA, right? Alpha hydroxy acids and beta. So you know alpha, what all comes in that? Glycolic acid, lactic acid, mandelic acid, right? And what comes in beta? It is salicylic acid. So salicylic acid is something which is going to act only if there is a presence of bacteria. Okay, salicylic acid peels is only going to act if at all you are having an infection. It is not going to act on any of the scars. Okay, so if at all it is a scar, you ask the patient what kind of peel. They'll tell you, because it will be written beautifully. What kind of peel? Okay, this peel. Okay, they have done this peel for this thing. So you understand, okay, if it is this peel, then it is done for the scars, right? Okay, if it is a salicylic acid peel, then definitely it is done for a pimple. Okay, so when it comes to chemical peels, whenever the patient comes to you, ask him or her how many days you remained indoor, how many days you were using the sunscreen, how many days you were sitting inside the house. Have you been told about what is the aftercare? See, in all these aesthetic procedures, the procedure is very simple. Okay, just apply the peel, wait for just few minutes, you just wipe it off, you tell tata bye bye. But it is not the case when it is about the aftercare. The aftercare is very important, because if at all you are not interested in the aftercare, you should not go for chemical peels. Okay, if you can educate your patient regarding the aftercare, then only you go and do the chemical peel. Because if at all you are a doctor who is doing chemical peels, because most of the Ayurveda doctors in the northern side, they do chemical peels. If you are doing chemical peels, but please be sure, make sure that you are educating your patient about the aftercare. That is very important. If at all you give a call from your clinic also, it is far and good. Because most of the cases, I got a 25-year-old girl. She came to me and she was having that melasma. Okay, the correct, the right classical spot. So I asked her, how did you, at this age, I asked her, what happened? How did you get it? Oh, doctor, I just went for a peel. I had a party, so I did a party peel. So I asked her, how often you do a party peel? She said, doctor, whenever I have a party. So I asked her, how often you have a party? Once in a week, or like once in 2 weeks I have that party peel. So I mean party, so I do the peel. And so I asked her whether you use any sunscreens. Yeah, I use any sunscreens, but still I just roam out in the sun. See, that is the reason she got that hyperpigmentation, and she is here for treating that hyperpigmentation. So once, and her skin is very sensitive. Okay, her skin is very sensitive. I've given her external things, and now her sensitivity has come down, and it is the only time which I can give my medications. Okay, so please be very cautious once you are doing the chemical peeling. And next is the other aesthetic interventions is like lasers, pulse dyed lasers, which target the blood vessels within the skin, reducing the redness and inflammation, and diode lasers, which heats the sebaceous glands, reducing their activity, potentially inhibiting the bacterial growth. Okay, and we have the erbium YAG lasers. And we have blue and red light therapy, the blue light which kills the bacteria, and the red light which soothes the inflammation. Okay, so now let's come into our section, which is, this is oftenly correlated as Mukhadushya. Just Shalmali Kantagagara Pidaga, Sarucha Kana, Kabhavada, and Sushruta has mentioned it as Vada Kaba Shonida. Okay, so the Nidana, the dosha is Kabha and Vada. So Kabha means the excess sebum, and Vada, I told you, there will be hyperkeratinosis. There will be the much of the desquamation of the cells. So that is, which is part which is played by the Vada. And Dusha is Rekta, which is vitiates and obstructs the pores. And Vada predominant conditions means scaling, dryness, and blackish discoloration. See, doctors, when you are getting scaling, dryness, and blackish discoloration, it is little bit difficult to cure, and it is little bit, the result, you have to tell the patient, see, you have to stick on to the medicines and you have to wait. When it is Kabha, itching, pus, oiliness, and comedogenics, that you get wonderful results. Okay, if the patient is standing with you, if the patient is means okay to take all the patyas, and he or she is taking all the medicines, means you can give wonderful result in this. And also in the recta, redness, warmth, and pus also. Okay, so when it comes to mild acne, so what was a mild acne? There is a presence of comedones, there is a presence of what? Papules, there is a presence of pustules, but it is scattered here and there in the face. Okay, so that is a mild acne. So there is no problem once you touch the face. There is no problem. If at all you are doing a facial, that is also okay. Okay, so that the lesions won't get that much disturbed. So you can do Kshalanam with Triphala and Eshtimadu. Okay, you can do Swedanam with Nimbatok and Triphala. So how do? You can make it into a small potli, if at all. And you can just dip it in the hot water, and you just look the temperature on the dorsal aspect of your palm. Then slowly give it in the area. And then you extract the comedones. And if there is pustules, it is ready to break, then you just give that small thing that will just break it out, and you just clean that area. And you can do lebhanas. You can use Lodradi. You can use Tribhala for the Lebana also. You can Lebana purpose also. You can use with this Nimbatok Churna, Nimbapatra Churna. You can use, no problem. And you know about the Varnya Churna, right? You can use that also, no problem. Here we are using mostly in our practice, we are using secret use flawless pack, okay? And you can give high frequency treatment. So I think most of you know high frequency treatment. For those who don't know high frequency treatment, see, this is a small equipment, okay? It is having the argon light, okay? So what it does is, like, once we are doing the treatment, it is giving the excess oxygenation to the tissues, okay? And it will also remove the excess oiliness, okay? So in case of comedones which we can't extract, so what we do is, like, we put this high frequency over the area, and then we just take the wand off. So what happens? The area becomes excessive dry. So it is easy for us to extract the comedones. The patient won't have that much pain. Otherwise, what happens is, like, most of the cases, the patient will say it is paining and it will become red and all. So instead, because already it is the lesion is there. Okay. So next is, like, vegetable peeling. You can do vegetable peel powders. It is available in the market. Or else you can make your own. How you can make? Rice powder. I don't want that rice powder to be very smooth. It should be a coarse powder. You can take any of the clay. Better if you can go for bentonite clay. You can use a flawless pack. Instead of flawless pack, you can use Eladigana. Eladigana also you can use for Lebana also. Okay. Eladigana Churna you can use. And you can use any, like, Lodradigana, Tribhala, you can use, no problem. And you can take Chandana also. That is white Chandana and Yeshti Churna. Okay. Then you can make it into a mixture and you can mix it with egg white. Because why do we use egg white? Because we need something which is creating a coating over these lesions. So veg peeling, you have to be very judicial when you are using, when the lesions are little bit more painful and kind of cystic. Because once it is such kind of on such kind of lesions, if you are using vegetable peeling procedure, because after the application of vegetable peel, you will be using the massager, the face massager. So what happens? You will be irritating the entire thing. Okay, so it's better you just stick on to using the vegetable peeling procedure for mild acne. Okay, you can use galvanic treatment. So I hope most of you have heard about the galvanic thing, no? Even we are using in our clinics. So instead of if you don't have any gel with you, you can purchase what? You can purchase any of the aloe vera gel. And what you can do, you can put some Triphala Kashaya, you can mix into it, or you can make Kashaya with Lodradigana, you can mix into it, or you can take the drug of your choice and mix it into it, and then do the galvanic treatment. No, it is having a positive point and a negative. Negative we use for cleansing, and the same with the gel itself, we are going for the cleansing procedure. Okay, and then we wipe off the cleanser, the entire product. Why? Because you have used the negative this thing. Okay, negative probe. So what happens? The excessive oil, the dirt, everything will be present in the gel which you have used. So you wipe it off entirely and you put another gel completely, and then what you do, you put it in the positive and you do the procedure. When you put it in the positive and you do the procedure, the entire product is absorbed inside. Okay, so I hope it is very clear. So the blemish free gel is our preparation, so which we normally use for the galvanic treatment, and enlivening gel also, which is a basic aloe vera gel. Okay, basic aloe vera gel with cucumber also in it. Okay, so that is the enlivening gel, and we use when it is more pustules are there, we go for our licorice magic gel. Okay, which is basically HT in the major amount. And when it goes to the moderate acne, in the mild acne, what happens? In the mild acne, after the papules and pustules have come down, you can go for our Ayurveda facials. Okay, you can go for the facials. How can you do? You can use the cleansing. For cleansing, you can take any lemon juice, or you can even use rose water, or you can use milk with little like a pinch of salt or something. You can just cleanse the face very simply. Okay, you can use scrub. For the scrub, what you can do is, like, you can take that our Triphala Churna in any of the in the massage cream which you have made for the massage procedure. You can put it in that and you can use as a scrub. That is also possible. Okay, like that also you can do a facial. When it comes to the moderate acne, what we do is like cleansing with anti-acne cleansing milk. This is anti-acne cleansing milk is our product, which we have made the cleansing milk with Triphala and Nimbatok Churna and some of the drugs, okay, which is the proportion of the medicines is around 25% in that cleansing milk. Okay, so it is giving a excessive wonderful result, but there is a small problem with the smell. You won't be having such a wonderful smell. Okay, so with that, we do the cleansing. And then we do the steam procedure once it is more of pustules. I told you, you have to clear it off. Okay, don't keep the pustule as such, which is phaga as such, and let the patient go. You just break it off, open, and you clean it off, and then only you let the patient go. Okay, in all these cases, you have to give internal medicines also. Labanum with water you can do, and veg peel you can do, and galvanic also. In the severe acne, Shalanam, Labanam, Multani tea, and with Vaja, Lodra, Dhaniga, and Twak with honey and lemon, and Jaluga Vajaranam also you can do. Okay, so how do we do a extensive treatment procedure? You can do Shodhana, you can do Vamana. Okay, Ishti Churnam, 30 grams you can take, and with 3 liters of water you can boil, and you can give it as for the Vamana, Sadhyo Vamana procedure. Okay, Nasya you can do. Virejana with Avibhati Churna you can do. For Shamana, you can give Labanam and internal medicines. You can opt any of the internal medicines. Nimbadika Shaya, Arabada Mahatik, Arabadadika Shaya, Mahatik Taranga Shayam, Padoladika Shayam, Tiktaranga Shayam, Anjishtadika Shayam, etc. Okay. For the blackheads, you all know the pore is open. I mean the duct is open, right? It's open with the plug. So what you do, you have to extract it out. So you take a scrub, you scrub it properly, you give it steam, and you take it out with the the scrub, the heads remover thing. Okay, so you, or else what you can do, you can massage it with the Triphala and egg white. And you can do high frequency. I told you, you can use any gels and use high frequency. So what happens, the entire oil will go off. So the blackhead will become dry. So once the blackhead is becoming dry, the adhesion reduces, like the adhesion with the walls reduces. So it will stay as single. So what happened, once you just put a small pressure, it will come out. Okay, Triphala with curd and Eladigana Churnam with curd. Okay, vegetable peeling you can use, followed by the use of massager, peel off mask. So peel off mask means, charcoal peel off mask. Such kind of masks you can use. And after extraction of comedones, pack is a must. See, I have seen most cases, what they do is like they extract and they just let the patient go. No, don't do that. After the procedure, you have to always put a pack. Okay, that too, you have to always put a cleansing pack. And cleansing pack is very important. Then only you should let the patient go. The pores you have opened, and don't let the patient walk out with the pores open. You put the clay, because clay is having the binding property. So clay will at the end of the day close the pores. Okay. So next we will move on to a case study. I'll just show the pic. So this is an after pic and before pic and after pic. I can't see your messages. Otherwise, I would have asked you to just message what all lesions you can see. In this, you can see blackheads. Can you see? Yeah, these things are blackheads. She was having numerous blackheads. Okay, and you can see the this is pustular lesions, and this is cystic. Okay, these things are cystic. These things are cystic. See the blackheads. See. After that, her pimples has started to become crust-like. Okay. See, she's having pigmentation also. So this patient was 30 years old and she was having pustular to cystic lesion with mild itching, mild dandruff for 3 months. Okay, she was complaining it since 3 months. So she is just dandruff, I think she's having for a long time, because she just noticed this once she was having the pimples. Okay, regular abatya ahara intake. She was always taking all kind of abatyas. Okay, and irregular menstrual cycles, USG, but doesn't reveal any PCOS pattern. Okay, so what was given? The treatments like Nirgundyadi Kashayam, Nimbadi Kashayam, and Tribalak Shalanam. See, these Kashayams are selected at different times. Okay, first visit itself, you don't give all the Kashayams. Okay, like first visit, after one, you get the other, you give other, you just change the medicines. Okay, anagen vitalizer oil was given for the dandruff. Instead, you can, what all you can do, you can give the this thing, Durdura Patradi with Malatyadi combination you can give. And for the external application, you can give Tribala Churna, or you can mix Tribala Churna with Nimbatuk Churna, or else you can give this thing also. With Lodradi Gana also you can give, and because she was having pustules and there was mild pain also you can give. Okay. And Virejana with Avibhati Churna, Chandraprabha Guliga was given, Nidfort tablet was given. Okay. And Sadhyo Vamana plus Virejanam after 2 days. Then we did this thing, veg peel powder. Okay. Small, mildly we did, and galvanic treatment was done, high frequency was done, and herbal facial was done, and Lebanam with a flawless face pack was done. She was reluctant to what? This treatment, Jaluga Vajranam. She was very scared of Jaluga, otherwise we would have done. Okay. And the other cases, you can see the patient. See, she came to me like this. See, full of, this girl, she eats only paramburi. Okay, she doesn't eat anything else. She just eats paramburi and fish, fried fish. That is her main food. And egg. Okay, nothing else she eats. So you can see the difference. See? See, doctors, once you are treating such kind of cases, no, you have to tell them why we are sticking on to such a diet, and please make it sure that you give them some, some kind of diet which they feel little bit fancy. Okay. Nowadays, these teenagers like to say, like, I stick on to a very good diet. Okay. I eat a lot of vegetables. Okay. I eat a lot of fruits. I eat dry fruits and all. They like to boast. Okay. So your diet should contain them. And without their knowledge, you just take out the other things from their diet and tell them, see, you are having such a wonderful diet. This is what you have to eat. So, and if you are telling them don't eat dosha and idli, they won't tell yes. They'll tell dosha and idli because I am eating it from once from my childhood, and you're telling me don't eat dosha and idli. You tell them, okay, you can eat dosha and idli, but do one thing, you don't put that masha. Instead, you just make the dosha instant without masha, and you just make it like that and you eat. And if you want to make it more tastier, you add ragi. So she'll just frown. Ragi, is it that tastier? You tell her that is very tastier. You just try it out and tell me. So definitely they will try it out and they will tell you because they know this is healthy. So because nowadays what these people are doing, they'll take the pic of their plate morning, afternoon, evening, night, and they post it in the Instagram. So they want something new. So give them something new like that. Okay, like that only you have to approach the patient. Don't tell them, I won't let you eat dosha and idli. So they will never come to you again. Okay. Instead, you tell them, let's make your diet little bit fancy. Okay. So let's include these things in your diet, and these things are pretty unhealthy. So let's take it off for the time being. And instead, let's make it colorful like this. So they'll be pretty happy. Okay. And tell them you have to send it to us. So they'll be again very happy because they will be taking these pictures. They will be, adjusting the color and everything, and they will be sending it to you, and they will be putting it as a status also. So lots of them will come and ask them, oh, from where you got such a nice, suggestion and all. So they'll tell, okay, from this doctor. So you will get new patients also. So please have an innovation in everything, in every way. Innovation in the products, innovations in your prescriptions, innovations in the way you approach a case, and innovations how you deal your patient. Make them happy always. Okay. So this is a female, 18 years old, and presence of comedones, papules, pustules with itching and menstrual history, nothing specific, and no familial history was there. The drug of choice was Trayandadi Kashayam, Nimbadi Kashayam, Vilvadi Guliga, Vibhati Churna, Tribhala Gugulu, Shonidamradam, Arogya Vardhani Vadi, which was given in different stages. And Purodil tablet was given, galvanic facial was given, veg peel was done, and secret use anti-acne facial 3-sitting was done. Okay, we do have cleansing milk, we do have scrub, and we do have massage gel. Okay. And we do have a pack also. So that was done. And Triphala compressive, this is one of the, I just forgot to explain about this. So whenever the patient comes to you, you have nothing to do. You have nothing to do, but you want to do some treatment. So tell the patient, you just lie down, because patient is coming to you to experience something new. You are putting a board, Ayurveda cosmetologist, and you're just prescribing the medicine and letting the patient go, means they also feel it very bad. So you can't do, see, the pimples are very much pimples she's having. It is very much flared up. You can't even touch, okay, in this case, you have to do all these equipments, but you don't have these equipments with you. Okay. but you have to do some treatment. So what you do, take Tribhala Churna, make it into a kashaya, ask the patient to lie down. Once it is becoming once it is okay to apply, you take some cotton, you dip it in the Tribhala kashaya, keep it on the area wherever she's having that issue. That is a compress. That is a type of treatment. So patient also will feel like, okay, doctor has done something. After that, you put a pack, Triphala pack with any of the drugs which you want. You can take Varnam Churnam also. You just mix it and you just, but the problem is with the 1 year churnam is like sometimes the patient will complain about itching, but Triphala, they won't complain anything. So if it is a first visit to keep the patient in your hand, go for Triphala. Okay. See this case. This is the case which came to me. She was having a fever. After fever, she got these kind of multiple eruptions. See, I didn't do any treatment. Okay. I didn't do any treatment. I didn't do anything. I just gave her internal medications and I just gave her the external applications, just that. Okay. So what do you understand from that? You can manage with that also. Okay. So after the slight fever means her ESR was little bit up and she's 28 years old and no external treatment was given. Internally, Pajanamradam Kashayam, Shaddaranam Tab, Annabedi Sindura, Agati Churnam, Vilvadi Goliga, sorry. And externally, I gave her blemish-free gel and flawless pack and Trubalak Shalna. Now she's not having any such issues. And she also complained to me regarding some kind of vaginal, discharges, which is a little bit burning and painful and all. Now she is okay and she has gained weight also. Now she's perfectly healthy. Okay. So she's the one person who is always, referring patients to me. So next is acne scars. Okay. Acne scars, the treatment of acne scars is a little bit difficult because, the hyperpigmentation, the post-acne post-inflammatory hyperpigmentation after acne is easy to tackle, no problem. But you get scars, ice pick scars, which is very deep. How is an ice pick scar? It is just like a conical dip. Okay. And you get box scar. How is a box scar? It is like a, how do I say? Like a, it is having 3 edges. It will be little bit in a deep. Okay. And rolling scars will be not that deep. It will be shallow. Okay. But the diameter of rolling scar is more than box scar. So and you get hypertrophic and keloid scars also. So you can do Ayurveda facial, which I told you. Galvanic facial is very nice. And ultrasonic machine is also going to do wonder in this case. Okay. And Manjishtadi Kashayam, Drakshadi Kashayam, Guluchadi Kashayam, ultrasonic with brightening gel. I always go for brightening gel when it comes to acne scars and I'm getting wonderful results. And micro needling also I'm doing. And you can do one thing. In that case, what you can do is like, you can give that Nyavara application on the face. That also will give you an excellent result. Okay. And see the case. See, she was having that very deep scar. This scar is not healed because it is very deep. And you can do one thing when you get such kind of scar, and if you have the interest to know more and study more, do one thing. You do that pen cautery, pen cautery through the borders. So what happens once you do the pen cautery means you are disrupting the harmony of the cells, right? So what happens again? What will happen? The cell regeneration will be happening. So once the cell regeneration is happening, but you have done it in the borders, no? So there will be slowly the cell will come up. So what happened? That scar, that dip will be completely cleaned up. Okay, like that also you can do. So the product which I gave externally is Skin Elixir Premium Face Serum and Brightening Gel. And our Skin Elixir Premium Face Serum is in the collagen base. Okay, collagen protein base. So it is good for the scarring procedures and also for the anti-aging. And we gave brightening gel and ready to apply face pack. Okay. So the healthy skin diet. So when it comes to diet, you have to be very cautious. See, once you take something out of the diet and you are putting something here means the patient must be pleased. So don't make it little bit difficult for the patient. Okay. As I told earlier. So if she or she is fond of much of this thing, rice means you tell them just to cut 1/4 in the first week, then cut half. Then instead they'll be having excessive cravings. Okay. So you just put some bowl of, green grams, which is, boiled green gram, boiled channa, something in the food in this side. or give some raw vegetables or fruits, or you ask them after this thing, you take by 4 or 3, you have this juice. Like that, you tell them. Okay, but better thing is like ask them to stop the intake of sugar. Okay. So yoga to control acne, you know, the halasana, sarvangasana, pranayamam, you can ask them to do the chandranadi pranayamam, bhujangasana, malsyasanam, ushtrasanam. It's very important. It is very effective. So basically, when it comes to acne, hormonal acne, you tell the patient to eat very light in the night, preferably if they can avoid cooked food, cooked heavy food. Okay. So thank you, doctors. So I think this session was somehow helpful for you. And thank you so much for your patient listening and for your time. And thank you so much.
Thank you, ma'am. Thank you for a wonderful explanation about acne and its management with all the practical tips and suggestions. Thank you so much. Before we go on to the discussion session, I would like to once again remind you all about the upcoming courses, which mainly contains like all the cosmetic aspects as ma'am discussed. So more of acne management and other skin conditions, as well as the trichology part, that is the postgraduate diploma in Ayurveda Cosmetology and Trichology course coming up by AyurvedaMap. And we have almost like 9 seats remaining. So hurry up, participants. Kindly contact AyurvedaMap as soon as possible to book your seats today for this wonderful journey about Ayurveda cosmetology and trichology. And you will also be getting hands-on training. So again, one more courses, postgraduate diploma in clinical cosmetology. And we have diploma in Ayurveda cosmetology. These are the 3 courses which mainly concentrates on cosmetology as well as on the trichology. So kindly pick the appropriate course you think for yourself, and also you may suggest to your colleagues and friends who are interested in learning more about cosmetology and trichology. Kindly contact AyurvedaMap. Also, we have Pushya certificate course in Ayurveda gynecology, and also a product making masterclass Siddhi. So once again, I request you all to go through the courses, upcoming courses, and grab the opportunity as soon as possible. So thank you so much, ma'am, once again. So we will now move on to the discussion part. So I request the participants to kindly put your questions in the chat box. You may also unmute yourself and ask the questions. There are a few questions in the chat box already. So Dr. Rupa is telling Anna Bedi Sinduram how to use dosage and up to how many days to be used.
Yeah, I just give her 2 weeks, doctor. 101 for 2 weeks I gave, Dr. Rupa. After that, I moved on to the Hemocode syrup by Kottakkal Ayurvedashala. Okay, which is little more safe. And I got one more questions. How can we differentiate acne from skin cancer? That, doctor, you can understand it very well, because the borders won't be that much, defined when it comes to skin cancer. And you can also opt for the cell biopsy also. Okay, if you have any doubt in that. So even though if, nowadays what happens is like most of the cases we are going and we are doing what? We are doing cauterization. So if at all you see the borders are not that defined, and the bumps is sometimes up and low, down, such kind of things, if you see, you definitely have to go for biopsy. Okay, don't take that thing out. Please go for biopsy, and then make your portion safe, and then only you go for the rest of the manipulations. Okay. Okay. What is blemish gel? Doctor, blemish free gel is our product actually, doctor. There's a product of secret use. It's not a cream. It is a gel, okay, which we have formulated with chantana and nimbatok and all those drugs, which we use for a like for the acne cases. When you get acne cases, as I told you, it is very difficult for you to give creams and all, because this will again clog the pores and it will add on to the process and it will worsen the condition. So what we normally do is we give the gel, and then we give the pack also. So what happens once we give the gel and the pack, the entire oil will be controlled. even when it is in the case of a combination skin, because combination skin is something which is very difficult. Okay. See, doctors, you have to be very judicial. Like when a combination skin comes to you, he or she will come to you and complain like this: doctor, I have been using this product for this much time. Now I am getting pimple. Okay. So what you have to tell them is like, see, when you are having a combination skin, your product choice will differ according to your food and according to the season. Okay. When it is a winter season, the oiliness on this area will come down. So this will move on to a normal pace, but this will become a dry. Okay. So in that case, what you need something which is controlling, which doesn't hamper the hydration and moisturization. See, the 2 point is very important. The hydration and moisturization. We always talk about moisturization. We never talk about hydration, but you have to talk about hydration because hydration is very important. Because what does the people do is like they strip off the entire the entire oil from the face, and you get what sensitive skin. So for that, you have to hydrate your skin. You have to give so our brightening gel is a hydrating formula. Okay. So we give blemish free gel. After that, we move on to the brightening gel, which is hydration and moisturization. So we tell them, instead of moisturizing cream, you apply this and wait for half an hour. Then you apply what? Any kind of sunscreen or something of your choice. Okay. How to treat milia? Milia, I always don't go for any kind of cautery. I just break it open with a insulin syringe. I take the matter out. I just leave it as such. Okay, just cleanse off the part and just leave it as such. That's it. And yeah, Sadhyo Vamana, how I gave is was 30 gram of HT was taken with 3 liters of water. We boil it. Okay, we then strain it out, and then we give it as glasses for the patient to drink. Okay, even I have gone through the Sadhyo Vamana. I was also hit by the adult acne. So acne is very special to me. Okay. So will you please suggest some for packs for acne? See, you can make packs with Lodra. You can take Manjishta. You can take Chandana. You can take yeah, these 3 drugs are going to Vaja. These 3 drugs, such kind of drugs you can take for the pack when it comes to acne. Marks. You are asking marks, huh? I thought marks means you are asking about this thing, no? That hyperpigmentation after the post-inflammatory hyperpigmentation. No? You can go for that option, doctor. That is better. What we do is like we apply our D10 pack. Okay, we have a D10 pack, which is we have this thing formulated. We do like that. Doctors, I suggest you should first of all open your Dravya Guna. You should read. Okay, make small combinations. You take just 100 grams of each churna. Okay, you just keep it in small bottles. You when one case comes, you just write down, I took this much of this quantity. I'm giving this to the patient. When the patient comes back, you just write, okay, this changes I have seen. Like that, documentation is very much needed. We have documented such ways, and we have developed our single products. Okay, like that you get a variety of combinations. So what do? You normally don't go for personalized care because that is very difficult for you to manage. So when you combine all these things, you get a combination. Then you try it on the same cases. Then you get wonderful results. Means that is successful. Okay. Nyavara helps in acne scars means Anupama doctor നമ്മള് Nyavara tape ഒക്കെ കൊടുക്കുന്ന സമയത്ത് നമുക്ക് എന്താന്ന് വെച്ചാൽ ആ ഒരു എന്താ പറയാ ആ ഒരു സ്കാർ ഒക്കെ വന്നിട്ടുള്ള ആ ഒരു ഡൾനെസ് ഒക്കെ ഉണ്ടല്ലോ അത് കംപ്ലീറ്റ് ആയിട്ട് അങ്ങ് പോകും. That dullness will completely go when you go for a Nyavara tape, but make sure there is no acne. Okay, when you in that Nyavara you do one thing, you infuse our drugs. You make it into the kashaya, you cook the Nyavara in that particular kashaya, then you give. That also will give you wonderful results. That is how we do the procedures at our clinic. Okay. Can you repeat? Yeah, scars I normally opt for our facial is there. Rejuvenating facial is there. We have a cleansing milk, we have a scrub, we have a massage cream, we have a pack that I will do. Okay, clubbing with that, what I do is like ultrasonic procedure is there. One machine is there. And if you have a hydrofacial machine, you get that probe in the hydrofacial machine itself. That also you can use. Okay, so like that also you can manage the case. Am I visible? Yes. You like that you can do, and you can do micro needling. You have you heard about a derma roller and derma pen? Like that, with that also you can put the needling procedure, and after the needling procedure we use our serums. We use our serums for the needling procedures. Like that you can do. And if you want, you can go for PRP. That is also good. Externally, internally you can give them the medicines. Okay, then you get wonderful results, doctor. See, very simple things, no? You have heard about these things in our classes somewhere, somehow, right? But we are getting all these results, better results, because you are not treating the skin. You are treating with internally. That is the reason why you're getting these results. That is very important. That is why I was explaining it is a scientific session, because we are treating a disease scientifically. We are not giving here the treatment so the patient will come next time. Again, we treat here and we let the patient go. Again, the patient will come. Again, we are doing this. Okay. Teenagers also need to follow the same kind of treatment. Teenagers, doctor, you have to ask for the routine of the teenager. And there you will get a hint. Somewhere, somehow, they will be doing some kind of things which is not that much wholesome. And you have to check the scalp also, whether they are having dandruff and everything. So like that, if you treat, again, you will be getting good results. Okay. Because keeping the dandruff in the head and you're treating the face means you don't get the result. Okay. Open pores can be closed completely. When it comes to open pores, na doctor, you get the micro when you purchase a micro needle, you get a nano needle. One thing is there. With that procedure, we can do small needling things, and we can do ultrasonic this thing. We get good results, but I don't tell we are getting that much boom results for us to showcase. I never got such a great result. But when the patient is coming to us in the early stages, just the open pores is started, they are coming, we can give the result. But if it is as wide open, some cases it will become very big. Okay, that it will take time. Okay. Dr. Priyanka, you can contact me. You can get the products, doctor. What is the treatment of pimples during menstruations? The answer is then the question itself. The patient is having pimples during the menstruations, completely hormonal. We just ask her to check with her diet. Just give her a diet correction, doctor, and just give her some of the, our Surya Namaskara. Surya Namaskara, I always suggest, doctor, because Surya Namaskara is doing wonders. Okay, because every point, every chakra is, concentrated when it is coming to Surya Namaskara. So you can give that. And internally, you just give some Andishtadi Kashaya or something like that, Shonidamrita or something like that, it will be get corrected. Okay. Doctor, hydration and moisturization, the difference is moisturization is something which we give the cells, no? That is the oil balance. Hydration means it is the water balance. Both is different. Okay. Surgical scar on the face. Doctor, you can send me the pic, doctor. I will just give you the suggestions. So let me see the scar, how it is. Cosmetologist who doesn't makeup, who does makeup regularly due to occupational reasons. So, Dr. Kalyani ran out. That is a tricky question for me, huh? How to approach a patient with cosmetological issues who does makeup regularly due to occupational reasons. Okay, once she's home, ask her to remove all the makeup and let the skin breathe, and give her simple chalanas in the beginning. Simple chalana and simple triphala, this thing, pack. So first of all, ask her to remove the complete makeup and get a good steam. Then cleanse off the face with triphala kashaya and wait for a little bit of time. Again, cleanse off the face. Again, ask her to wait and then put the triphala pack. Like that, you just do for 1 week and let me know what is her feedback. Okay. How to remove acne spots or for clear skin? Can you suggest? Can you suggest application medicine for quick results, ma'am? How to receive the acne spots or for clear skin? Doctor, it differs, doctor. Sometimes the acne spots may be dark black in color, blackish spot. That is little bit difficult to go. The combination used for that is different from that which is pinkish scar. That is different. Okay, one is pitta, one is vada. Okay, so that it differs. Okay. Most probably what I do is I go for such kind of spots means I go for microneedling. Definitely I go for microneedling where I want cell regeneration. Okay, I go for that. Then I give my product through any of the mediums like ultrasonic or something like that. I give my product inside. And I give internal medications also, like Drakshadi, something, Gluchadi, according to the condition I give, and then I correct the symptoms. So we can't use Nyavara boiled with milk pack if severe acne. No, no, doctor, because don't give Nyavara with a milk pack to the acne condition. It is very heavy. Don't give that. Doctor. What is aftercare? Doctor, aftercare means after salicylic acid peels, ask them to remain indoors. If at all they are indoors also, they have to apply sunscreen every 2 to 3 hours. Okay, that is, they should not expose. See, once you are doing the peeling, means your stratum corneum is completely exposed, na? So I mean, your stratum corneum is completely taken off. So your baby layer is coming to the play. So it is not that much, matured to resist all the harshness. Okay, so you have to remain indoor. You have to apply all these sunscreens and everything, and ask the patient to remain indoors and not to get that directly exposed to the sun. Even though she's inside, she has to apply sunscreen. And what I suggest is like after 1 week, you go out. Okay, and sometimes the patient will come with sensitivity also. If it is that peeling and everything procedure, na, so mostly it will come like that, red and all. So that time also we ask the patient to remain indoors. So if I say 10 days, 7 days they tell, but I would like to tell you 10 days for taking the why 10 days? Because that is a safe period. Because otherwise what happens means you go to the sun, and if at all you get exposed, your baby layer is getting exposed. It is getting damaged in a higher pace. Okay, you get pigmentation definitely. No doubt. And don't use any products on the face once you have done peeling and procedures and all. They'll give you some moisturizers and all. That's only you are supposed to do. Doctor, in the Sadhyo Vamana, we are not giving any grita, nothing like that. You ask the patient to follow a correct diet, and then you are giving 30 gram of churna, which is boiled in 3 liters of water, and then you give one glass full. Ask the patient to drink the kashaya. So once it reach here, the patient will give you one bout. Then again, you ask the patient to drink that. Okay, the rest whole thing. So around 9 bouts all you will get. That is the excellent this thing. Okay. I did Vamana and I got excellent result. Yes, doctor. For making kashayas means for making kashayas for cosmetic preparations, na DM water is must. See, doctor, if the face is much oily and you are putting excess of oil in the scalp means there are chances it induces acne. So what I always tell them, when the scalp is oily, when the face is oily, when the hair is also having an oily texture, I ask them, see, you apply oil once in 2 days in a week. That's it. Okay. Skincare for under eye dark circles. Under eye dark circles, I always go for under eye creams. We have under eye creams. You can go for good massages, under eye massages with any of the medium. And if you don't want to use any cream, you can use milk, and you can use Nyavara also. Like that, you cook it and you just give nice slender massages, and you focus on some other point, and you give eye exercises. That will do wonders. Okay. Can we use serum with lactic acid, and green tea for pore tightening? Pore tightening. Doctor, I'm not very sure like whether lactic acid, glycolic acid will give you the pore tightening. For pore tightening, definitely you need some binder. That will be a clay. Yes, doctor, my contact details will be provided by Dr. Akshata. Doctor, is this session available once again, doctor?
I will just confirm it.
Okay. Okay. For oily skin, open pores in Ayurveda, what can be done internally and externally? You can use that pudina, this thing is there, na? That you can dry it in the shade, and then you can apply that. So in Ayurveda, you can like that single drug that is good, that is having good results. And what you have to do is that don't allow the face to become more oily again. Okay, apply gels and packs and control the oiliness. That is a first line of treatment which you have to give for an open pores. Because of the oil only they got open pores. Okay. Silicone-based sunscreens, I don't usually suggest, Dr. Pavitra. I don't suggest. Oh, you want me to recommend something? Huh? How can I recommend something when I am standing with a brand with my hand? How can I? So we don't have sunscreens, being very frank. Good sunscreens means, doctor, you should always go for an aqua-based, whether you have an oily skin, dry skin, nothing. I always suggest for an aqua-based sunscreen, 50 plus. Whatever you get, you please buy. Aqua-based, 50 plus, and 50 plus plus plus. And you don't need matte, because matte at sometimes it can trigger the production of acne. Okay, so always be safe. Now people are hyped about Korean products, especially centella extract, especially for hydration and skin brightening. Yes, doctor, our product is having centella extract for a brightening purpose, our brightening gel. Okay, can what's your take on this on acne for prawn skin? Can centella be used for oily? Yes, yes, definitely centella can be given for such an or such a combination, because we have developed our combination in this basis only. Our combination is centella asiatica with aloe vera extract with kunkuma. That is our combination, and we are getting excellent results, doctor. Excellent results. No, Nyavara is Shashtika Shali, doctor. Mustache area. Doctor, you just check for the any kind of dandruff, anything is there. Repeated cystic and nodular means you have to give internal medicines, doctor. You just check to his diet and everything, or else you revert to me with all the case history. I'll tell you what to do. Okay. And you give kashayas accordingly. Then only it will get reversed. Because in cystic and nodular, the external applications has a role, but more internal is having a result. Okay. So I always convince my patient to have internal medicines. Brightening face pack with Arjuna Lodra, Vajja. You can take Triphala, little bit of Triphala, the half of this thing. And you can take our Varne Gana as such. And you can make a pack that will help you in brightening. Nyavara is Shashtika Shali, Dr. Sarita Jain. Cosmetic acne treatment means, doctor, when it comes to a cosmetic acne, you have done something inside and then you are getting, no? So go for Visha line of treatment. Okay, that is best. See, doctors, once a case comes to you, just try to understand what has triggered the case. What has triggered the case and what are the symptoms. That is your treatment protocol. Okay, so there is no treatment protocol. I have given you some medicine suggestions. That is, you need not use that medicines. I would suggest you need not use, because if at all another case comes to you, I might not give that medicines, because what I try to figure out is what is the problem. How do I correct it? My formulations and my combinations goes accordingly. Okay. Scalp acne, yes, scalp acne is something which is very difficult to treat. I told you, only in the scalp that thing is there now, doctor. So you have to go for packs, hair packs with curd mixed. You give hair packs containing triphala and lemon peel powder. And you can add other drugs if you want, but just triphala is also going to help you. But give internal medicines. Okay, he or she will be showing the symptoms of aggravated pitta and kaba somewhere somehow. Then you give hair packs. Then you can do hair packs. First line of treatment would be hair pack, and just wait and see how it is coming. And after that, you can give oils. First hair pack is the line of treatment. Then only you go for hair oils. Okay.
Any further questions from the participants?
I hope the session was helpful for you.
Yes.
What all cases we can do microneedling? Microneedling you can do in almost all cases, doctor. If you have a if you are having aging signs, you do microneedling. If you have scars, you do microneedling. All that cases you can do microneedling on the face. So I want you doctors to practice Ayurveda cosmetology from today itself, huh? Okay, so I hope you understand that it's not a big thing to do, right? You are treating with all your, all your medicines, our medicines we are doing treatment, right? You are not using any wonder drugs. You are not using any other of the any other drugs like nothing which is very secret drugs, nothing like that. Okay, you are doing your treatment with the drugs which is already there. Okay, with the combinations with you're already there. You just treat one case. After that, you are going to get immense, this thing. Dr. Atida, can you please type it, doctor? Ma'am, whether AHA
See,
based.
ma'am, they can unmute also. Somebody
Yes,
asked
doctor.
whether they can unmute and talk.
Yeah,
Yes,
Dr. Atida,
participants, you can unmute and ask your questions.
Dr. Atida, if you can't unmute now, you just type it. I saw the face, the picture you have posted. Just elaborate, doctor. AHA face, yes, can be used. No, doctor, AHA based face wash and all, they're mild peelers, no? Once your problem is solved, don't use, you use plain face wash. What I used to say, even they are having an acne, like I used to say in the weekly 4 times, the bus, that's enough.
We have come to the end of the discussion session. I feel so, and we are getting all the questions in the chat box as well, and few photos also. We've also got many feedbacks from the participants, so we will take. There's few more questions in the chat box, ma'am. Dr. Atira, ma'am, that scar after plastic surgery after an road traffic accident. Okay,
I
can
know that is difficult to heal, doctor. Am I audible, doctor?
you're audible, ma'am.
Yes, that is difficult to heal, doctor, because it has become a stubborn scar. Okay, that is a little bit difficult. I can't give any assurance. Okay. Can
Dr. Saida has
is it
shared a
Milia?
picture.
Doctor, when I see it like that, I feel it. Some of them is Milia. Can you just say share this picture personally to me? And can you please message me personally regarding this thing? Once I look like that, I feel it like Milia. If it is Milia, it will be having a white top. If it is Milia, you just break open, doctor, and just check her lipid profile and just go through her, sugar levels. Okay. Marks of acne can be removed, doctor, when it is fresh. Okay. But not like more than 10 years. If you get it, means it will be little bit difficult. Marks of acne, it can be because my face also had a lot of marks. Okay. But now it is almost healed because I was working on it continuously. That is the reason. Okay. But if you have a acne mark, you keep it for a long time and then come means sometimes it might be different. Anyways, Dr. Kalpana, you share the pics. Like, let me see what type of, what kind of marks it is. Okay. To an extent, we can manage, doctor. To an extent, we can manage. Definitely, we can manage.
Also, participants, kindly give your feedbacks. I guess most of the participants have been sending their feedbacks. Thank you very much for a wonderful session. A lot of them. Anybody would want to unmute yourself and give your feedback, talk about your experience.
Yes.
Okay, doc.
PRP. Treatment role in this. PRP is always done, doctor, for the, for the rejuvenation of skin. Okay, when just giving into a vague thing, I would say it is PRP is always on the side of rejuvenation. So you can do PRP in the case of this kind of treatment, like in the scars also. But PRP just PRP is not going to give you the result. PRP plus microneedling plus the continuous usage of the products with internal medicines is going to give you the result. Okay, because when it comes to scars, they come and ask you what they come and ask you, doctor, how can I, can I do carbon laser and all? Even with carbon lasers, they don't get that much result for the scars. Okay. I have so many questions. I haven't asked. My concept are not cleared yet as I have few patients of melasma. Doctor, you can collect my number and you can contact me. Okay.
Dear participants, I have shared Madam's number in the chat box. Kindly contact her. And thank you so much, all participants. Yes, for recordings, you may contact AyurvedaMap for this session. And also, if you have any questions or queries, you may contact AyurvedaMap as well as Madam. Her contact number is in the chat box. So, Dr. Anjali will we be giving training for microneedling and other procedures discussed here. Yes, in the further sessions of the course, of the certificate course, postgraduate course, you will be given the training. And Dr. Parvati, excellent language and presentation, doctor, one of the best sessions I have ever experienced.
Thank you, doctors. Thank you so much. And I want, I feel really proud to be a part of AyurvedaMap. And actually, I would say Dr. Jasal is one of my very close friend of mine. Okay. He was my junior from the college and we share a very cordial bond. And I would always suggest you people to have such a great friend. Okay. Always, who is always appreciating you, who is always there behind you to push you in the front. And I would like to thank my fellow partner, Dr. Gauri, for making my dream come true, because Secret Shoes is is a cosmetic brand which we both have actually founded. And I would like to thank my parents, my child. She has gone through a lot, because I am always in the traveling mode. Okay, taking classes, going for the AyurvedaMap sessions and all, but she adjusts pretty well. And I would like to thank my friends also. They are always I don't know whether most of you people are Malayalis or not. So if you are people are Malayalis, you have seen some film section, from that Aju, where I think it is Aju Varghese and Nivin Pauly, she is telling, he is telling, I have told you many times, don't motivate me like this. Okay. So I have a set of friends like that and my family. So that is my strong pillar. And it's a great pleasure to see you all. And thank you, Dr. Akshata, for the excellent moderating, doctor. And thank you so much, doctors. If you have any doubt, you please, if I won't be available in calls, doctor, definitely I won't be available in the calls, but I will be available in the WhatsApp. You send me the cases. If you are students of PGDAC, you have a Telegram group, no? You put it in the Telegram group. I'm there. I'll just, deal it there itself. Okay. Thank you so much, Dr.
Thank you, ma'am. Wonderful having you with us today, and it was indeed a very interactive session. Lot of questions. It was like uh, uh, continuously we had questions, and yes, definitely all your questions will be answered, and you may contact ma'am as well as contact AyurvedaMap. You may join the course, and you will get the complete guidance regarding cosmetology and trichology. And yes, Dr. Jasulla is also here. Would you like to add something, Dr. Jasul? Not able to unmute. Okay. All right. Thank you so much, ma'am.
Yes,
Yes, doctor.
yes, thank you, Dr. Akshada. And I was there in the from 7:30 itself. It was very interesting session, very engaging session, even though it deals the modern aspect as well as Ayurveda. Ma'am has explained very nicely, very good language, and it was very worth watching all these slides. Very engaging session. So thank you, ma'am. It was a very beautiful session, and the question answer session also was very engaging. Thank you, ma'am. Thank you so much.
Thank you, Dr. Jasu.
Thank you, Doctor. And we look forward to having you in the upcoming sessions of AyurvedaMap. And also, participants, thank you so much for joining and for your active participation. See you all in the next session of AyurvedaMap, and hopefully see you all in all the courses, upcoming courses of AyurvedaMap. I would insist you all to spread the word to all your colleagues and friends and Ayurveda doctors who are interested in upgrading their skills and want to learn more after BAMS. So kindly spread the word. Thank you, ma'am, and see you all in the next session. Thank you.
Thank you, Akshara. Thank you so much.
Thank you.
Good night, doctors. Thank you for the patient hearing, doctors. Good night.
Good night, ma'am.